So many like her are putting in all they can. They couldn't revive him. To get past the shortage of beds, they've packed in stretchers, wheelchairs, as many as they can. But the first line of treatment against COVID-19 is oxygen. And they've almost run out. At this point, there is just 1 hour of supply left. The staff knows how many lives hang in the balance. People are being turned away, but they don't know where they'll find oxygen or a bed. Manora Bibi was taken in for a short while to stabilize her. We've already been to 5 hospitals. Where will poor people like us go? Her nephew asks.
Fires are never extinguished. They bring the bodies in on wooden planks for mass cremation. So many souls released before their time. So many deaths from a virus that many in India had thought was in decline. They've created makeshift crematoria in the centre of Delhi and other cities to deal with the seemingly endless cycle of death. Families are in shock because if the country had been better prepared, if there had been enough oxygen, if politicians hadn't insisted on holding election rallies with no social distancing or masks, those on the pyres might be alive today. And then there's the deaths of 13 people in a COVID ward in Mumbai that caught fire last night. The hospital director said a ball of fire erupted in the ICU and smoke engulfed the ward. They've launched an inquiry. People are desperate. In Lucknow, a young man pleads with his mother as she struggles to breathe. "Nothing will happen to you, mother. Please keep breathing." And he lies down there in the hospital car park in protest and despair because he cannot get her admitted. It's the same story in Delhi. Critically ill patients are arriving at a hospital only to be turned away because the beds are full and there's no oxygen.
I've been everywhere, searching for 2 days for a hospital to get my mother admitted. I've visited all the hospitals in Delhi. They all say the same thing, that beds are not available. Another patient, my son, is at home. So who do I take care of?
My mother needs oxygen. There are no beds available, nor oxygen anywhere in Delhi. I phoned the helpline numbers. They said they don't have any beds. I went to each and every hospital in Delhi. Can you please help me?
Ambulances lined up outside hospitals that can't take any more patients. Oxygen shortages that have pitted different states against each other. Doctors and nurses pushed to the limit as they scramble for resources. Lines are hours long at testing sites. After many months of relatively few cases, this comes as a shock here. I've been waiting outside the testing center all day, and we are yet to be tested. I just pray to God, because if we are tested positive, then where will we go? We are helpless. Epidemiologists say India missed crucial opportunities to prepare for a second wave. The government didn't hire more doctors and nurses, and it allowed massive public gatherings, which may have been super spreader events.
Everything from beds to oxygen cylinders, ventilators, and the drugs needed to manage infected patients. This 1,000-bed field hospital, patients keep coming. Dr. Parveen Saini, a scientist with India's Center for Scientific and Industrial Research, is one of them. He can barely breathe. His elderly uncle's appeals to the gods have failed. Dr. Saini's sister Shweta cannot believe what's happening. Ambulances bringing the bodies from hospitals are being asked to wait for 4 or more hours.
लोगों ने मजाक समझ रखा है कोविड का 2 पेशेंट मेरी गाड़ी में एक्सपायर हो गए हैं इसी गाड़ी में एक्चुअली बेड अवेलेबल नहीं है मैं अस्पताल लेके जा रहा था जबकि वो उन्होंने दम ही तोड़ दिया
All around us, people are in shock, unable to fathom what's going on. Pandit Madhav has worked here as a priest for 7 years.
युद्ध ही है समझ लो कि एक तरीके से मैंने जी बिल्कुल अपनी जिंदगी में अभी तक तो नहीं देखा जितना रश अब हो और बॉडी डबल ट्रिपल आ रही है कोविड की बॉडी सबसे ज़्यादा आ रही है जी
With the numbers expected to rise all over India, graveyards and crematoriums have made urgent appeals to their respective governments to increase capacity.
About to take place in early April, despite mounting evidence that it had become a super spreader event. Thousands of pilgrims who attended have tested positive for COVID-19.
Prime Minister Modi's Hindu nationalist government did not cancel the Kumbh Mela for several days. Eventually, the Prime Minister appealed to the clerics to make it a symbolic event amid protests from attending pilgrims.
Scary pictures at the Bhadbhada crematorium in Bhopal.
84 में गैस कांड के पीड़ित के बाद दूसरा ये वक्त है जो हमको देखना पड़ रहा है उस समय मैं 9th क्लास में था 9th क्लास के बाद आज 50 साल की एज में आज पहली बार मुझे दूसरा मंजर देखने को मिल रहा है अभी तक यहाँ 30 से 40 लाशें जो जलाई जाती है क्योंकि कोविड से रिलेटेड.
And now concerns are being raised on whether the state is actually reporting the correct death toll due to COVID. There were 37 COVID bodies at this single crematorium in Bhopal on Monday. The health bulletin for that day mentioned a total of 37 deaths in the entire state. Scenes at the crematorium a clear mismatch with the COVID fatality figures from the state.
3-4 घंटे से बैठे हुए